We have an epidemic on our hands, and it isn't COVID. Our healthcare system is completely failing Americans, and people have been outraged for decades. Where are things going wrong, and how can we fix this? Today's video is meant for people who haven't totally been through the ringer of our healthcare system yet and want to hear how it's failing people who are currently living with chronic illnesses such as ME/CFS. Now, there's a lot of discussion on the internet about healthcare costs, lack of accessibility, and hospital deaths from medical errors, but not many people are talking about the facets of how it fails people living with chronic illness, down to problems that they have getting everyday care. So the purpose of this video is then to identify where healthcare is failing people so that we can advocate to our government on how and where it needs to be fixed. This video is only going to be drawing from my personal experiences because I don't want to be a secondary source for other people's personal experiences. I want to let them speak for themselves, but I also will be drawing upon statistics from used in studies, and I hope you enjoy today's video and find it helpful. It's not just me who's had a bad experience with our healthcare system. The majority of patients who are suffering with this condition are having the same experience. And so here's some just quick statistics. 79% of long COVID patients reported negative interactions with medical professionals. Over 70% have received no advice at all from their general practitioner on managing the condition. And 80% of bedridden patients who requested from their doctor at an at-home visit were denied. One study found a majority of physicians downgrade the illness to a non-disease status. And so when patients try to correct doctors, they're labeled as combative and hostile and difficult. And even published literature cites them as unhelpful patient group. 28% of ME/CFS patients report they were given very poor medical care, and 22% report receiving no medical care at all. Can you imagine how bad your interaction with the healthcare system has to be for you to report received no medical care? That's 22% of people. NIH currently still advises ME/CFS patients undergo graded exercise therapy and cognitive behavioral therapy, even though studies have proven this is harmful to 40 to 50% of patients who get worse under these therapies. Yet this is the main treatment recommendation that NIH advises. Patients feel pressured then to comply with things like graded exercise therapy and cognitive behavioral therapy because they want to avoid being seen as difficult and refusing care. And so they decline at the recommendation of their doctor. 66% of patients report that seeking medical care from a doctor actually worsen their condition. So 2/3 of patients have gotten worse because they've seen a doctor. 30% of physicians don't even believe their patients have any illness at all. We have a system that gaslights patients, that ignores patients, that gives them poor medical care or none at all. The healthcare system is a mess. And so let's buckle up and break down where these problems are. Now, I'd like to move through the problems that I faced with the healthcare system chronologically. So if we go back to when I was first exposed to hydrazine, I was at work and I stumbled across the street to the hospital where I was pale and sweating and faint and weak, and I had no idea what was going on, and I just collapsed in the emergency department. Now, one of the quote-unquote top toxicologists at the hospital came and visited me. And he explained to me that the way toxicology works is that there's tens of thousands of different toxins out there that you can be exposed to, but really there's less than a dozen different antidotes for them. So treatment really relies upon just managing the symptoms and letting the condition play out. Now, that was really just an excuse for administering poor medical care. I don't even think he even ordered any blood work. Now, if he had just read some of the literature on hydrazine exposures, he would have found out that treatment involves administering pyridoxine. And that's supposed to mitigate some of the nerve damage that hydrazine causes. And if he had done that right away when I was initially exposed, that might have substantially helped my long-term quality of life and saved dozens of hospital visits and doctor's visits that I've had to make over the years. And there was not even any follow-up investigation done on his end. He didn't try to contact any other professionals who have had patients with hydrazine exposure. He didn't research the mechanism of the toxin in the body. And he didn't even refer me to another neurologist for a follow-up. So if doctors just take patients seriously and give them the best care possible from the get-go, then they may be able to save them from a decline later on and save tons of other hospital visits if their initial treatment is better and they care more and are less worried about pushing the patient out the door. Now, the next point that I'd like to make is one that anyone with a chronic illness can tell you about and has experienced for themselves, and it's that doctors need to stop diagnosing patients with anxiety. Now, the reason they do this is because when you have a condition like ME/CFS, all your blood work comes back normal. And doctors have no idea what's going on with them, so they have to pull out of thin air some sort of diagnosis, and they pick anxiety because it's one that everybody knows what it is and they're familiar with, and that way they can feel accomplished by diagnosing the patient, and also they don't look like they don't know what they're talking about. And then when the patient is dissatisfied with the poor medical care they ultimately will receive, they can dismiss the patient as they're difficult to deal with and emotional because of anxiety. Now, we all know that this condition is not anxiety. Anxiety can help to flare some of the symptoms more, but this is absolutely not a psychological disease. We all know that. And doctors just overdiagnose anxiety all the time. In a public survey, 94% of patients reported that they experienced medical gaslighting of some kind. So this is something that everybody is dealing with and familiar with this problem. And doctors need to stop doing it. If they don't know what's wrong with the patient, they need to just say, we don't know. Let's investigate it more and take these patients seriously. Because for myself, it literally took years for me to build up enough evidence between, I've tried pharmaceuticals, I've tried talk therapy, I've undergone evaluation and all these things in order to rule out anxiety so that I could actually get proper medical care. And patients shouldn't have to go through that. Anxiety shouldn't be labeled onto people who are experiencing pain and chills and all these neurological symptoms, who report that they've never felt the feeling of anxiety, or if they do, it's a byproduct of dealing with all the health issues. The next way that the healthcare system needs to improve is that there needs to be more identification and diagnosis of comorbidities, along with proper reflex testing when those diagnoses are received. So when I was initially admitted inpatient in the hospital after I developed a chronic illness, I had all sorts of tests being done, and for the large part, they were coming back normal. But one abnormality that was found is that my orthostatics were very poor. So orthostatics are measuring your heart rate and blood pressure when you're lying down, and then you have the patient stand up for a while, and then you take them again, and you measure that difference in that heart rate and blood pressure. And so mine went from, when I was lying down, I think my heart rate was 50 beats per minute, and upon standing, it was 140 beats per minute. So that's the equivalent of going out and going for a sprint. Just standing there shouldn't cause your heart rate to be that high. I should have been diagnosed with, at the time, POTS, which is postural orthostatic tachycardia syndrome. And at least 25% of patients with ME/CFS have POTS. So if a patient presents with ME/CFS, that's something that should always be checked. And that's really easy to do. It doesn't cost anything, and it takes very little time or effort to check your orthostatics. But I wasn't diagnosed with POTS when I should have been. When I was diagnosed with POTS, there needed to be reflex testing for that. So when you have POTS, it can be really common to have a series of autoantibodies. Those should immediately be checked for. In addition, conditions like Ehlers-Danlos, which is a connective tissue disorder, reflex testing with a neurologist who can test QSART, which is an autonomic test that checks like how much your skin sweats, with in addition to a small fiber nerve biopsy, should have also been done. And then POTS itself has various treatments. For me, they didn't really work too well, but they work for people with POTS generally well enough that patients should try them. So that includes compression stockings, high salt diet with lots of fluids, eating smaller meals, and then some medications like fludrocortisone, pyridostigmine, midodrine, and beta blockers. So those are different medications you can try to help manage POTS. So there's a series of different tests and treatments that the doctor should have ordered on his own based upon the orthostatics that I was presenting in patient. None of that was diagnosed, none of that was tested for, and none of that was treated for. So those are things that all should be done. So there needs to be more awareness for some of these comorbidities, and doctors need to be proactive enough to test and treat for things so that the patient doesn't have to spend all their free time with no medical experience trying to figure it out themselves. Next is the lack of medical awareness. The medical system should be aware and versed in how conditions like POTS and ME/CFS can hit. There is no education, whether in medical school or otherwise, as to what triggers the condition, what tests should be ordered, lifestyle changes, medications, supplements to try. All of this should be distributed to doctors, and they should be prepared for when patients come up with these illnesses, because they're so common. Millions of patients have POTS, millions of patients have ME/CFS, millions of patients have fibromyalgia. They're not rare conditions, they're extremely common. And we're not treating it that way. So when you have ME/CFS, when it first hits you, doctors have no idea what's wrong with you, they have no idea what it is, and even if you receive a diagnosis, they have no idea what to do with you. It's really unfortunate because it's totally unnecessary. You shouldn't have to start from square one with what is this condition every time a new person is diagnosed. All of the reflex testing, proper lifestyle management, medications with higher chance of success, anything that can be done to either improve or prevent the condition from getting worse or anything like that, all of that needs to be recorded in essentially a guidebook and presented to the doctor managing the patient and the patient themselves, so that they can avoid all the problems that other patients had to go through that either led to dead ends or led them to getting worse, and get them closer to things that actually do help patients. And this can be done so easily and cheaply. All doctors and researchers need to do is to distribute a simple survey. What has helped you? What has not helped you? What have you tested positive for? Like in a simple survey, patients can report all these findings that have been significant or beneficial to their life, and they can report this, and a very quick, simple statistical analysis can determine what doctor should be recommending to patients to try and what to avoid. And if there is a list of things to try, what's the top priority? What's most common, or what has the biggest benefit? To try those medications first and to test for those things first. So this is something that's very easy and cheap to do, but it's like the whole medical system has amnesia whenever a new patient comes along. And so there needs to be better medical awareness, and there needs to be records that are kept and distributed. The next topic that I'd like to cover is one that doesn't affect most people with a chronic illness, but it's such a major problem that we absolutely have to talk about it. and this is workers' compensation. So if you're unfamiliar with how workers' compensation works, it's basically an insurance pool. Every week, a little bit of your paycheck is taken out and put into this large pool of money that everybody in your company shares. And if somebody gets injured in the workplace or sick or whatever, that money is allocated to go back to them to cover any of their lost wages. And so when I became chronically ill after a chemical exposure in the workplace, I filed for workers' compensation. And my employer denied the claim. And they used this excuse, well, maybe he's sick, but not because of anything that happened at work. And they could get away with it because chemical exposures are extremely difficult to prove. You can't just take an x-ray and show, hey, here's a broken bone to be able to prove the injury. Chemical exposures can be impossible to prove depending on what you're exposed to. So my point is, workers' compensation is not the safety net that it appears to be. If you're not injured in a way that has overwhelming evidence to prove it, it's assumed you're lying. This whole innocent until proven guilty motto, it applies in the case of workers' compensation to the employer to protect them rather than the victim. So there's just absolutely a major loophole in the system for chemical exposures in the workplace, which are extremely common, and they can manifest in all sorts of different ways over all sorts of different periods of time. So take, for example, I was just reading an article the other day that said that people that are exposed to a common dry cleaning chemical have a 400% increase in the risk of Parkinson's disease. So there needs to be more protection for people who are exposed to these chemicals in their workplace and can have all sorts of crazy long-term effects because of it. So countless victims are being screwed over by this system that's designed to protect these employers. And when these victims become too sick to work and don't have all the energy and money and resources to fight this large team of lawyers that these major companies have at their disposal to defend themselves in these workers' comp cases, then the employees just lose out on all their income. And when they're too sick to work to make more money, their savings are just drained away, and they can't afford medicine and care and the life they need to get better to get back to work. So our system is designed in a way that if you get sick, you stay sick. You can't get better. And workers' compensation is a major piece of what needs to be changed. Now, here's a point I'm sure everyone can relate to. Bad doctor's appointments. We've all had them, and they're super frustrating, especially when you have a chronic illness where these doctors just don't know what to do with you. And worse, they don't want to know. They don't want to research your condition. They don't want to read any of the publications that you bring them. They just want to refer to whatever they were taught in medical school, which is almost nothing. So you're just sent on this endless string of referrals from doctor to doctor to doctor, and no one actually helps you. So the only way to get help in a doctor's appointment is if you're the doctor. You have to be prepared. You have to come in with a specific medication that you want to try or test that you want to get done, and have to give them a sales pitch to try to convince them to get the help that you need. So these doctors have become a barrier for medical care rather than a resource for it. And then all the bureaucratic work that comes along with doctor's appointments, it always falls on the patient. So if you're trying to get a referral to see a specialist, you have to play phone tag between offices, faxing medical records back and forth, which in the 21st century, why are we still faxing medical records? It's very wasteful and laborsome and not secure. We need to move to an online internet system that all of your providers can access. You have to fill out the same forms multiple times, which is, when you have chronic fatigue, absolutely exhausting. And if you don't have the energy to do that, then you're neglected and you won't receive medical care. On top of the wait times for these appointments, which are ridiculously long, I've personally had a doctor's appointment that was booked a year out, and with wait times like that, patients can be getting sicker and sicker and even dying before they even get to see their doctor. Once you even get in there, they don't even have sympathy for you. I've had one doctor say to me, "Your quality of life is fine. You should just learn to live with it." As a result, I've just received better care from nurses than I have from doctors because they're actually concerned with making improvements to quality of life and listening to me. There's no pill that you can take to cure something like chronic fatigue syndrome. So they need doctors to work with them on the small things, managing their diet and lifestyle changes and disability accommodations. Help keep them functioning and as well as possible. And if doctors don't have a pharmaceutical to prescribe you, they'll just say, "We can't help you," and get you out the door. So doctors can absolutely do a better job. We need them to listen to the patient. We need them to work with the patient. And we need the offices of those doctors to help facilitate those appointments rather than just burying the patient with tons of paperwork. I'm almost afraid to talk about the next topic because of how bad it is. It's disability. So I have to share my story with you because it's so absurd but so typical at the same time. So I have now applied for disability 3 times on 3 separate occasions over the past 7 years. And I've been denied 3 times. And take, for example, the most recent denial. I submitted an appeal for the denial. That was denied. Then I hired a lawyer and took the case to court where a judge oversaw the whole thing, looked through years of medical records, so forth. He also denied it with just totally false assumptions that weren't even remotely true. And so now I'm in the stage of appealing the judge's denial, which denied my appeal of my initial denial on my 3rd denial. So this system is so bad. Even if you're the most disabled person in the world and you're just lying in bed and can't move all day, and there's just absolutely overwhelming evidence of how sick and disabled you are, you're still very likely to get denied for multiple years because the whole system is not about how disabled are you. The question is, how well can you prove that you're disabled? Now we're left with a situation where the people who are getting awarded disability are the ones who are actually less disabled because they have the energy to put together a really strong case and to fight the system. And the people who are too disabled to put this evidence together are the people who are losing the disability cases. It's totally backwards. Disability is one of the most major things that is just an absolute disaster. And it's totally unacceptable. I read an article, it was actually a couple of years ago now, that 10,000 people died the year before waiting for their disability application to be processed. It's absolutely unacceptable and atrocious, and people with chronic illnesses like ME/CFS are treated the absolute worst when it comes to disability. Most Americans are aware this is a problem in our country, but health insurance is not adequate and not covering the cost that it should be. I've even had my personal primary care doctor say to me, "I'm not even really your doctor. Your health insurance company is your doctor because your health insurance company determines what's approved and covered and dictates to your provider what they're able to prescribe you." And in addition to that, smaller things like personal expenses aren't covered. So with ME/CFS, there's no $30,000 pill that you can take to treat you, but instead we need smaller lifestyle management tools. So this may include air filters and massage devices and dietary needs. So none of this is covered. It all has to be paid out of pocket. And there's no available housing for disabled people. It's so bad in our country. In my state, there's only one partially subsidized apartment complex for people with disabilities. And right now, the wait list is 8 years long. And if you have something like an environmental illness, that housing situation is not just shelter, it's a medical device. And health insurance should be covering it. In other countries, they do this, but in America, they don't. And so we've got to fix our health insurance problem, not just with an accessibility issue, but what costs it will cover. People need shelter, and they need a safe living environment, and they need accommodations. So yes, the medical care that people are receiving is really poor, but the government itself also shares some blame directly. So I visited several different senator offices over the years, and I've been told they're supposed to help provide resources and be advocates for patients. And when people don't know where to go or how to get help, they can take care of them, they can direct them, they can help them. And that's not the experience I've had at all. I've spoken to multiple different senator offices looking for help with housing. I've just been told, oh, just call the 211 hotline. Well, I've already called the hotline and they can't help me because whatever little assistance that the government has for people, you have to be on disability to qualify for it. So if you're screwed over for the system and you're disabled, but you're not approved for disability, not only do you not get the disability, but you don't get any other help because you're not qualified as a disabled person. And so I begged with them and I pleaded with them, and they just say, nothing we can do. And they hang up the phone. It's really that bad. I went down to Capitol Hill in Washington, D.C. last year to advocate for funding for research for CFS. That it's been a whole year and they haven't even approved it. I reached out to these senator offices to follow up with them after the fact, and I didn't even receive a reply. So they are not doing their job. They don't care. They just throw patients out in the wild, leave them on their own, and hope they float. There are some other ways that the government can help too. Take, for example, online forums and medical groups like what's on Facebook. Those groups are critical for patients because they're not getting help from their doctors. They're not getting help from the government. Nobody has answers. These online groups are the only healthcare resources these patients have. So when they don't know what's happening to their body, when they don't know how they'll react to a medication, or even if they just need support from the community to help have the strength to wake up the next day, those groups are the only thing they have. And those groups are run by just admins, just Joe Schmoes living out of their basement, just normal people. And some of these groups are run really poorly, where these admins will just kick people out on a whim. And there goes all of the access to healthcare that person had is from those online medical groups. It needs to be an American right to be included in those. I don't think people should be kicked out from a medical group. I think it should be a right to be in there. Patients also need to have more access to experimental medications. And I say this because there are so many people out there who are extremely sick and desperate, and they would rather risk dying from an experimental medicine than go on living with their chronic illness. And that's their body, and frankly, it's their choice. And if you say, no, you can't have access to it, you just have to sit there and suffer, you clearly don't understand how bad this condition can be, how isolating, how hopeless, how bad the pain and fatigue and weakness. No human being should have to be put through that. So they should have the right to choose if they want to try this experimental medication, because even if the government says no, that's not going to stop them. They still are finding ways to source it. There are people in groups who are pooling their money together and getting experimental medication manufactured over in China and repackaged and distributed across the country. This is happening anyway. So at least do it in a way where patients are warned of the dangers, where somebody else can oversee what dosages they're taking and administer the drugs, and do it in a way that's legal, rather than having patients gamble with experimental drugs manufactured in China. There needs to be better access. Also, the undiagnosed disease program. Many people with a chronic illness have heard of this. This is an NIH sponsored program where essentially if your doctors can't figure out what's wrong with you, you can apply to this program. They'll take you in, run a bunch of tests, try to diagnose you with something. It's really basically non-existent because of how inaccessible it is. I've applied myself several times. I've never been accepted. It's extremely exclusive to get into that program. I eventually applied to a different program run by a different university, also called an undiagnosed disease program, but it wasn't NIH run, and it was really just an hour-long interview. They didn't run any tests. They just listened to my problems for an hour and then wouldn't respond after that. So there needs to be increased accessibility to undiagnosed disease program. It needs to take more people in, and they need to do a better job of running more tests and experimental tests and try to find some answers rather than making the patients do it themselves. And also, this is a difficult topic, but euthanasia, the suicide rate for CFS is extremely high. It's like 30%. And it's really sad. It's really sad. There are patients that are flying across the ocean to different countries, like Switzerland, to be euthanized there because the United States won't approve it. Please don't let these patients commit suicide on their own. Please don't make them fly to Switzerland. If they choose to be euthanized, please help them and let them go out in peace. And it's their body, it's their choice. This needs to be something that's allowed for chronic fatigue syndrome. Ideally, we should just make a better healthcare system with better resources to produce better quality of lives so people don't want to choose that option. But if they have to, then it's something that should be normalized. It's something that should be allowed. And people are just suffering way too much to a level nobody in the Senate, nobody in Congress knows what they're going through. And of course, this is a big one. NIH federal funding for ME/CFS and related illnesses research, it needs to be way bigger. So right now, our NIH funding for ME/CFS is around $15 million a year, which equates to about $5 per patient per year. And multiple chemical sensitivity is $0. It gets no funding at all, even though 1 in 4 Americans have multiple chemical sensitivity and 1 in 8 are diagnosed. And the condition can be just as severe. But the economic burden of a chronic illness like ME/CFS is $75,000 per patient per year. So we're losing out on $75,000 per patient per year that has ME/CFS. But we're only putting $5 of research funding in. It makes no sense. It's like trying to put out a forest fire with an eyedropper. It's not going to work. We need to put up real numbers that make sense, that can actually make a difference. And charities aren't working either. People that go to charities, it's inaccessible, and you only get assistance if you have very specific diseases. Usually there's nothing for anything like ME/CFS, or certain minority groups. And if you don't qualify for that, which most people don't qualify for most charities, your government isn't helping you, your charities aren't helping you, you're not getting any local, state, or federal help. You're not... How are you going to get better? How are you going to get better with no assistance from anyone? So just a lot needs to be changed. And if anybody is familiar with me or my videos, you know that I always tie everything back into environmental health. And so there needs to be a lot more focus on environmental drivers for disease in medicine. So really the only thing doctors do is they do surgery and they do pharmaceuticals. And that's really the extent of healthcare in the United States. And it boggles me. It really boggles me how millions upon millions of people have become sick with conditions like ME/CFS, and not a single doctor or researcher ever said, these people got really sick. We don't know how. Maybe we should look in their homes and investigate what they've been exposed to in their home and their life. They just think that if you're sick, that's just like an internal problem with you. Nobody considers the environment and bothers to look there. We are finding out now that a lot of diseases that were once considered totally genetic, like autism, we're finding the majority of these factors for the disease are environmental. There may be some genetic influences, but we're seeing a lot of conditions have like a split between 80% environmental and 20% genetic. So we have so many chronic conditions now on the rise, and we're not seeing that increase in research funding for environmental factors. Almost all our research funding is going to genetic stuff. People are too excited by it, and it's just a way to avert blame. I realize it's such a big deal to actually grasp, wow, everything around us, all this stuff we're manufacturing to make our lives easier is also making us sick. And it's like with lead back in the 50s, where when the research came out saying that, hey, lead's all around us and it's making us really sick and it's really bad stuff, nobody was taking those researchers seriously that were putting up that research. And all of the giant manufacturing companies were dismissing them. And I feel like the same thing is happening for VOCs and nanoparticles and mold and all these environmental factors. People are just closing out of their mind and ignoring. This needs to be a much bigger part of medicine. This needs to be a much bigger part of research and healthcare. And doctors need to be environmental specialists. Every single doctor out there has to have knowledge and exposure and consideration of the environment when they treat their patients.